This RAMAS 4.0, that fourth international conference on these advances in the social sciences, humanities, management, and scientific research, RAMAS 2025 and 27th June 2025. So myself, Dr. Devyani Dasar, professor from the Department of Shalatantra, that is the surgery of Mahatma Gandhi Ayurvedic College, Hospital and Research Center, which is a constituent unit of the Tamagi Institute of Higher Education and Research deemed to be University, Savangi, Wardha, Maharashtra, India. As I'm going to just enlighten the topic for the Deha Prakriti, that is the case control studies for exploring the association of the Prakriti with Bhagandar, that is the Fistula in Anu. So regarding this introduction, that this Deha Prakriti, this is actually psychosomatic constitution of the individual. With the concept of this Ayurveda, we are going to assess the patients. For example, here we can see that Desh Ka Prakriti Parikshan Abhiyan, that which is already run by Honorable our Prime Minister of the India. And also how we are going to constitute our Deha Prakriti, or how we are going to choose our Prakriti as per the Lakshanas found in this one. So here we can see that Vata, Kapha, Pitta. Like this, these are the basic constituents of our body, which are constituting these all the 5 elements having the earth, fire, water, air, and heat. And there is one of the pro forma given by the CCRS for the parikshana of this Prakriti. And in last year also, that are in government, from our government only, they carried out one of the abhiyan. So Desh Ka Prakriti Parikshana Abhiyan, this is a really today's emergent topic to discuss here. That's why I just choose this topic for this presentation. So this Deha Prakriti determines the susceptibility, severity, diet, and regimen in the Ayurveda, and it is given in that our classical text also. It examines a healthy person's or a patient's physical, physiological, and psychological traits, and recommended a diet and lifestyle for their good preventive medicine and a therapy. So while assessing all these things, we have to be encountered with all the complications in the contemporary medicines and also in the complex disease genetics. Here, the Desh Ka Prakriti Parikshana Abhiyan with the pro forma. Aim of this presentation regarding the study of association of this Prakriti with the disease, that is we are calling as a fistula in Ano, that is the Bhagandara, which are we are finding in the low socio-economic status widely. And objective is to evaluate the Deha Prakriti based susceptibility in the manifestation of these diseases in Bhagandara. So inclusion criteria in this one is the patients above the age of 18 and below the age of almost below the age we can see that with Bhagandara patients who have been the symptoms of that. That means there is one of the abscess cavity at the anal region or rectal region, and it may covers less or equal to the 5 years, which is considered in this group. And that study was generated from the 2015 up to the 2018, and both the incidences, prevalences cases, which attending this our hospital, they are prepared for the after giving their consent, they are recruited in this research work. So for parikshana of this Prakriti, we just taken the CCRS, CSIR Genomics Unit 3 Sutra, CSIR IGIB New Delhi to confirm. These are the softwares of this Prakriti Parikshanas. Also, there are the some of the that samples where we can collect this Prakriti Parikshana to confirm the healthy individuals and also the diet or lifestyle habituaries, which we can see from this pro forma. Exclusion criteria is having the diabetes mellitus and which are uncontrolled one, hyperthyroidism and also endocrinal disorders, and also who refuse to participate in these studies are excluded for this. Ethical clearance has been taken from our University Ethical Clearance Committee with the dated 28 February 2015. Now, there were 2 groups are mentioned where the both groups having this CCRS Deha Prakriti assessment scale. that is administered in their convenient languages. Here, some Marathi, some Hindi or English convenient languages, we prepared this pro forma to assess the different traits, direct observations, tactile examinations, interrogation by the single person. That is a standard operative procedures mentioned in CCRS Prakriti Assessment Manual. Based on that, we have did we did Deha Prakriti of individual patient. Here we are getting means for a Vata Prakriti, that is we are also called as an Ek Doshesh Prakriti, that is 66%, Dvandva is 25 to 30, and Samadoshesh means all will be equal in 30 to 34 percentage of peoples. Here, for this all collected data that are analyzed with the chi-square test to determine the relationship between the various socio-economic demographic variables and also that Prakriti with the Bhagandar. The man witness test is also applied to find out the mean difference of each of the doshas, where I received the P is less than 0.05, which was very statistically significant, and the main objective of this one is found in the Pitaj Prakriti, where there is a logistic regression coding the incidence of Bhagandara as 1 and 0 otherwise. Here we can see that that age group is result chart 1 having age group of 80 to 30, then 31 to 40, 41 to 50 cases which I enrolled that. Here are the 30% means 20, 40%, some 40% controls are also having the p value is 0.0, where in gender wise when we are talking about this, female are more prone for this disease then habitat, rural area and urban area. So urban area, I got a more prevalence rate of this fistula in anno. Among us is that the occupation having housewives, they are complaining more about this. And for the private sectors, definitely percentage are more. But housewives, afterwards urban area, afterwards females, and 41 to 50 years of age group, they are more prone for the fistula in anno diseases, which is called as the Bhagandar. Now, these are the result two that variables at Deha Prakriti prominence. So, Vata, Pitta, and Kapha. So, we are getting the Pitta. Pitta means all the burning, the materials which are producing a burning sensation in in their foods, in their bodies, and the lifestyle habitat having the late night working, continuous working, driving, that all will continue and all will come into the Deha Prakriti of Pitta. Deha Prakriti, which are in detail that we are calling as Vataj, Pittaj, Kaphaj and Dvandvaj also. So that are also depicted in this slide, which is having the p value less than 0.001. Now here are the result 3. Comparison of involved dosha in Deha Prakriti along the cases and the controls. So here again we are getting the Pitta. In that Pitta is that a very significant P value, which is a very statistically significant, not in Vata and a Kapha Prakriti. Afterwards, the Pitta value, that when we are talking about the correlation and also log odds for the Pitta and Vata Deha Prakriti, Vata Deha Prakriti. So in that one, Pitta, we are getting the odds ratio. So summary of this presentation, as the present investigation has indicated that Deha Prakriti is a risk factor connected with the Bhagandara, is really a very good pro forma as prepared from the CCRS, so that we can go to the common people and we can gather this information to this, and we can definitely manage the disease. Also, patient education in cognitive therapy that is effective in lowering the improper conduct and fostering positive health behavior adjustment as per according to their Deha Prakriti. Also, the intellectual error can be done through this cognitive therapy, and definitely it gives a significant relevance to the public health policies, their diseases, and we can reach to very common peoples, poor socio-economic status peoples, where the real base of our health of our country is dependent. So statistical analysis, there is definitely association with the Pitta dominance and development of these fistula in ano cases, where there is a lifestyle modifications with the high, some means that what we are already discussed in previous points also, that the burning sensations in the total body. So that the Pitta Kafish Deha Prakriti is the highest incidence of Bhagandara, followed by Vataj and Kapha Vataj. And community-based education programs that are also recommended diets and practices the lowers the Bhagandara cases. So I'm really thankful to my Dean, Mahatma Gandhi Ayurveda College, Hospital and Research Center. Also, the statistician, Mr. Lakshmikant Tumate, sir, for providing the statistical help during this a lot, big one, huge data. Also, Idoxia Research University, USA, and India for providing the platform for this. And there is no any conflict of interest. These are the references. Thank you so much. This is my team who is working day by day, and definitely we are trying to reach our common people. These are some of the photographs during this one. So thank you so much for giving this a very such a nice platform to me. Definitely in future we will meet you again. Thank you.